Dr. Khoo, what's the difference between sudden death and a heart attack?
Many people use both terms as almost the same condition, but actually they are very different conditions. Sudden death means that an individual loses his or her life very rapidly as a result of an abnormal heart rhythm, where the ventricle is pumping so quickly that there is no cardiac output or there is no blood being pumped from the heart. Heart attack refers to damage to the heart muscle when an artery that is supplying the heart muscle is blocked, most commonly by clot as a result of rupture of an arteriosclerotic plaque. They are treated very, very differently, and sudden death occurs when an individual just drops dead, right? Unfortunately, today, the outcomes of treatments for sudden death are very inadequate. Only 1 in 20 survive an episode like this outside the hospital, and they typically survive with a lot of very severe sequelae, such as brain damage and kidney injury. In fact, we are losing an athlete every 3 days here in America to sudden death. So once you have ventricular fibrillation, then you will collapse. Ventricular fibrillation occurs when the ventricle is not pumping in a coordinated fashion, but it has gone into an abnormal heart rhythm where it's only quivering. So when it's quivering, there's no blood flow. And when there is no blood flow, the organs in the whole body start failing. It typically takes about 6 seconds of no heart output in the average patient for somebody to lose consciousness. If you are a high performance athlete, perhaps you could last 20 seconds and still be awake when you are in ventricular fibrillation, but you will lose consciousness pretty rapidly thereafter. So when you lose consciousness and you collapse, somebody has to recognize first what is going on. And as the seconds tick by, you are still in ventricular fibrillation. By the time 2 or 3 minutes have passed, brain damage has begun to occur. The brain and the heart are the highest energy consuming organs in the body. So heart damage also starts occurring very quickly. And every minute that you go into this, you start going into multi-organ failure. The chances of successfully shocking you back into regular rhythm, which is the treatment for ventricular fibrillation, decreases by 10% as each minute passes. So by the time 3 minutes has passed, your chances of successful defibrillation is only 70%. By 5 minutes, it's only 50-50. When you are in 8 or 9 minutes into the episode, the patient is almost dead. And if you shock the patient back into regular heart rhythm, it is very unlikely that the patient will walk out from the hospital in a healthy state. They will likely have to go to the nursing home and continue a very long recovery process.
I have 2 questions for you. One then, is it genetic?
There's a high number of conditions that are genetic that cause sudden death. The most common one would be hypertrophic cardiomyopathy, which is the most common cardiac genetic disorder. It affects 1 in 600 people, and is the most common cause of sudden death in America. Other genetic conditions that can cause sudden death would be such as long QT syndrome, Lamin cardiomyopathy, and several other conditions. But there are many, many conditions that have not yet been identified that can also cause sudden death. Having a heart attack at an early age can also cause sudden death. And you could have heart attack at an early age as a result of familial hyperlipidemia or high cholesterol. You could have an early disposition to developing a heart attack as a result of early onset diabetes. So if you have diabetes and you have poorly controlled sugars, you could be also at high risk for developing sudden death.
And so when you say we shock them back, you mean we use the defibrillators that are at airports or at schools? Or
Correct. Let me ask you this question. Where would you think is the best place in America to have a sudden death episode?
The best place, the hospital.
That is partially true. Believe it or not, the best public place to have a sudden death episode is a casino. The thing about casinos is that every individual in the casino is closely monitored and watched. But they're closely monitored and watched for a different reason. They are watched for cheating, right? But because they are so closely watched, if somebody has a sudden death episode, they are quickly identified. And so the care that is required for an episode like this that is so dramatic and sudden is rapid. And so the delivery of the shock occurs early when success is at its highest. So the only treatment to date for sudden death, if you survive it, is actually the implantable automatic defibrillator. So implantable cardiovascular defibrillators are common. I'm an implanter myself. And right now in America, we implant between 150,000 to 200,000 ICDs yearly. The key here is still continued research and delivery of better rescue methods. This has been best studied in cities like Seattle and Boston, where the success rate for rescue for sudden death is at its highest. There is a joke that runs around in Seattle where if you are a jogger and you sneeze, you're at risk of receiving basic life support.
And why is that?
That's because the public education has been so comprehensive that everybody is aware regarding sudden death, and everyone has been taught to deliver basic life support.